Before we just go to the main part, hi hello guys, this is Medbits, your exam savior, and today we're going to discuss about hip joint complex, biomechanics, part 1. So in part 1 we'll be discussing about the basics of the hip joint complex and the acetabulum, head of femur, ligaments, muscles and tendons. So this will be the things that we'll be discussing about in part 1, and please make sure that you're also going to see part 2 because this is all the basics and which is very much important. You cannot skip it because it can be asked at a 2 marker or a 5 marker. They can ask acetabulum or ligaments, name the ligaments. So that'll be it. So in part 2 we will be discussing about the hip joint in detail with every single topic, which is very much important because they can be asked for 2 marker or 5 marker, or these all can be asked as a 10 marker itself. So yeah, so don't try to skip them. They're very easy, and if you try to remember them, then you're gonna get 5 or 10. Yep. So now let's begin the hip complex. Now the hip joint is also known as a coxofemoral joint. The primary function of the hip joint is to support the weight of head, arms and trunk. You can remember it as HAT, both in static erect posture and in dynamic postures. So please do try to write the exact words, because why means the examiners, they keep a blueprint to know that whether you're writing the specific words that they want to see on the paper. So yeah, if you just try to add up something by your own words, it may not happen. So yeah, you'll have to write it's a coxofemoral joint. The primary function is to bear the weight of arm, head and trunks. So like yeah, you'll have to say that. So hip joint is the articulation of the acetabulum of the pelvis and the head of the femur. Hip is a synovial joint with ball and socket variety. So, as we know, there are 3 degrees of freedom, which is flexion, extension in sagittal plane, abduction or adduction in frontal plane, medial or lateral rotation in the transverse plane. So, as you all have seen the diagram here, femur, the head connecting to the acetabulum of the pelvis. So, I'll be talking about detail in the next slide. So coming in detail now, let's come with the first point, which is acetabulum of the pelvic bone. So now this is a very much important bone when it comes to the hip joint. Yep, it actually sockets the head of the femur. It holds it up. So let's begin. In a simple way, let's say acetabulum is a socket of the hip bone into which head of the femur fits, located at the lateral part of the pelvic bone, right? So this is the lateral part. It will be tilted to the lateral part. The opening of the acetabulum is approximately laterally inclined 50° in the frontal plane, anteriorly rotated 20° in transverse plane, and anteriorly tilted in sagittal plane. So the lunate surface is proximal articulation surface of acetabulum. So this is the lunate surface. Looks like cup shaped, also called horseshoe shaped. Acetabular fossa is innermost part which is not into articulation. So as you can see here, acetabular notch is where ligaments are structured transversely, known as the transverse acetabular ligaments. Now these ligaments are very much powerful, and that's the reason why our hip stays in motion. So I am saying this once again, so please do try to take some of the specific words, such as it's look like cup shape, also horseshoe shaped. So these are very much important. Even this paragraph is very much important, so make sure that you mark them right. So guys, coming to the next topic, which is head of the femur. So as we know, the femoral head is spherical shaped. As you can see, the design here itself is spherical shaped. Now, because of this design, we have a proper range of motion, right? A fluid range of motion while we walk, while we do some sport activities. It is a really, really important design, right? It helps us in many ways that we could ever think. So before we're just going to continue, just make sure that you have a bone set, or even if you're just going back to your university and when you're in your class, just go and find a bone set and try to understand the parts as you can see here, which is the head, neck, greater trochanter, the trochanteric crest, lesser trochanter, pectineal line, linea aspera, gluteal tuberosity. So in the viva aspect, they may ask you in biomechanics also too, or if or they can also ask you in the anatomy aspect. Like if you're just gonna go for the anatomy viva, so they're just gonna ask about this too. So when it comes to osteology, they will ask you which all other parts, what are the muscles inserted to it. So yeah, the bones are very much important. So please do try to know them. So yep. So the head connects to the shaft through the neck as in figure. So the head of the femur is superiorly, medially, and anteriorly oriented. So the fovea is the depression on inferior part of femur head where the ligaments are attached. So the fovea is a small dot that will be, I think it's on the other side. So if you have a bone set, you'll be seeing it's a small depression. So it will be covered by the ligaments and yep. So that's it. So coming to the next topic, ligaments of hip complex. So the ligaments are fibrous structures that connect bones to other bones, right? So the hip joint is encircled with ligaments to provide stability to the hip by forming a dense and fibrous structure around and around the joint capsule. So yeah, so that's the reason why the hip joint is called as one of the strongest, one of the congruent joints in our body. So yeah. So before going to continue, so just write down the ligaments as you can see here: iliofemoral ligament, pubofemoral ligament. So first write down what all are the ligaments that you want to write down. So write down in the format like 1, 2, 3, 4. Then you start to explain them, right? So let it be presentable to your examiner who's going to correct your paper, right? So yeah, so the ligaments are very important aspect. So let's begin. Iliofemoral ligament. So this is a Y-shaped ligament that connects the pelvis to the femoral head at the front of the joint. It helps in limiting over extension of the hip. Okay, so the next one is pubofemoral ligament. So this is a triangular shaped ligament that extends between the upper portion of the pubis and the iliofemoral ligament. It attaches the pubis to the femoral head. So the pubofemoral ligament, it comes around here, yeah. Comes like it goes to the pubis, which is off here, this side, goes to the pubis. So yeah. Coming to the next one is ischiofemoral ligament. This is a group of strong fibers that arise from the ischium behind the acetabulum and merge with the fibers of the joint capsule. So guys, to remember the ischium, where ischium is a place where the quadricep muscles, they are also being originated from there. So the ischium and like that. Yeah. So the ischium part of the bone of the pelvis is very much important. So try to learn them in the osteology part too. So yeah, that will be it. So coming to the next topic, muscles and tendons. A long tendon called the iliotibial band runs along the femur from the hip to the knee and serves as an attachment site for several hip muscles, including the following that I'll be saying. So this is the iliotibial band, or known as iliotibial tract, coming from the ilium to the knee. So first muscle is the gluteals. So these are the muscles that's from the buttocks. Yep, the butt. There are three muscles: gluteus minimus, gluteus maximus, and gluteus medius. So these muscles really act while we are walking, standing. It helps in sitting. So the gluteus medius is important while we are walking. So the equilibrium of the hip. Gluteus maximus helps us while sitting down, sitting up. Yep. So each muscle has its own variety of functions. So that attach to the back of the pelvis and insert into the greater trochanter of the femur. So coming to the next muscle, iliopsoas. It is a deep muscle that originates from the lower back of the pelvis and extends up to the inside surface of the upper part of the femur, which helps for flexion. Okay, so coming to the next muscle, which is adductors. So these muscles are located in the thigh, which helps in adduction, right? So it'll be in the medial part. So yeah. Now coming to the next one is rectus femoris. So this is the largest band of muscles, which is located in front of the thigh. So they are hip flexors. So the rectus femoris is a part of the quadriceps femoris, like it's a main part of. So you should know the quadriceps femoris muscles when you learn anatomy, because they are very much important. They will be asked for 5 markers, or they may be asked for 3 markers itself. And yeah, the hamstring is also too very much important. They will ask quadriceps or hamstrings or any other muscles. Yeah. So hamstring muscles. These begin at the bottom of the pelvis and run down the back of the thigh because they cross the back of the hip joint. They help in extension of the hip by pulling it backwards. Coming to one of the next important topic, which is the acetabular labrum. So now this is one of the part which is why we have a real fluid range of motion, right? Now because of this we get a proper lubrication on our hip joint, and yeah, so it is very important to learn about them. So the fibrocartilaginous system attached to the peripheral of acetabulum. It deepens the socket and helps to increase the concavity of the acetabulum, increases congruence of the joint by better femur head grasping, right? And enhances joint stability by acting as a seal to maintain negative intra-articular pressure. So now this is about the acetabular labrum. Now let's talk about the applied anatomy, or what happens, what's the damage that can be caused. So the acetabular labral tear. So now acetabular labrum tear is mechanically induced pathologically. So result of excessive forces, so such as twisting, pivoting, falling or accidents at the hip joint leads to articular damage and destabilize the hip joint. So just imagine that if there is no lubrication for a hip joint, so it will be like bone on bone, and we'll be knowing each and every range of motion, which is going to be really painful. So it is mainly like this kind of problem is mainly faced by rheumatoid arthritic patients. Yeah. So additional causes include acetabular impingement, joint degeneration, congenital hip dysplasia. So congenital means from birth, and slipped capital femoral epiphysis. So yeah, as I've said, in the part 2 we'll be discussing about these topics, so please don't miss them out. We'll be uploading them so soon, so stay tuned for that. Congratulations guys, you have completed hip joint complex part 1. Yep, and that this was a complex topic to be completed, and I have made it such easier for you guys. So please don't miss out the part 2. Yeah, that's going to be much easier to understand. And yeah, and if you think that this video actually deserves a like, subscribe and share, please do that. And yeah, see you on next video. Bye.